It's very important to find out what your parent has already thought about. They have been watching peers have health problems, die, and they're already dealing with it and confronting with it, probably more so than you are. So it's much more in their conscious mind than it is in yours. There is some planning that we can do in advance without having to put that burden on our children. And I don't think any loving parent wants to put that burden on their children. If in fact there isn't a plan in place and a crisis happens, then often that's a blessing in that it's a wake-up call that we need to not wait again for another emergency before we try to figure out what we're going to do. We need to plan in advance about that. You have a commitment to wanting to do everything that you can to ensure the quality of life that they have is sustained for as long as possible. You want them to start thinking about what if their health starts to fail and the reality is that they need to move someplace else. That there's a very good likelihood that a lot of the history, a lot of the past among siblings is potentially going to get in the way of the ability to have a healthy and open discussion about what our mom's needs or dad's needs and how do we best plan for that. We can engage in dialogue with one another and not necessarily need to talk on the phone. We can use email. Identify, what's your take on what's going on with mom or dad, and what are the kinds of things that you think we need to start dealing with, and doing that in email, which tends to be a far less threatening and confronting environment, so that we can start sharing some ideas.